Texas is breaking records this week. Today, the COVID positivity rate hit a new high for the 11th day in a row. The state reporting the rolling average is more than 34%. KXAN's Maggie Glenn reports on how this Omicron wave compares to the one we saw in the summertime and how the rapid community spread is already straining hospitals across Texas.
As Omicron jumps from patient to patient, hospitals share the same need across the state. From Amarillo,
we have rooms where we could put people, but we don't have enough staff to match up.
To Austin,
the hospitals are experiencing staffing shortages.
To Dallas,
we've got vaccinated healthcare workers that unfortunately get the Omicron variant and then they have to isolate, which further strains the existing workforce.
Doctors worry the initial messaging that this variant is less severe has Texans letting their guards down.
If we all get an illness, even if 90-something% of us have a relatively minor experience of it, that few percentage of folks that are less fortunate and have a more severe illness, that is enough to overwhelm the healthcare system.
Over the past 10 days, COVID hospitalizations have increased 99%. Over a 10-day period during the beginning of the Delta surge, COVID hospitalizations increased by 76%, a relatively similar rate. But during the Delta surge, it took about 26 days for our positivity rate to double. For Omicron, it took only 10 days.
The data we're looking at suggests we're going to see more hospitalizations and greater staffing shortages than we have faced with prior situations.
The solution, however, remains the same: mask, vax, and boost.
If there's a silver lining in it, it may be that because it's coming at us like a tidal wave that hits us, it will likely hit us in a short period of time. The next few weeks are going to be critical, and there's still time to impact that.
Maggie Glenn, KXAN News.
And right now, 4 of Texas' 22 trauma service areas report more than 15% of patients in their hospitals have COVID-19. That used to be a trigger for local counties to be able to roll back business capacity, but the governor took that power away beginning in March of last year as vaccines availability increased.